Today on Cancer Buzz, remote monitoring of patients on CAR T-cell therapy. I'm your host, Summer Johnson. New remote monitoring techniques for immunocompromised patients were born out of necessity during the pandemic, prompted by a need to reduce patient exposure to COVID-19 in hospital and clinic settings. Our guest today is here to tell us about a CAR T-cell therapy remote patient monitoring program that helps patients avoid a lengthy and costly hospital stay. This innovative program allows patients to be seen daily in the outpatient setting and then return to their home or lodging, checking in with providers virtually at multiple touchpoints. This outpatient remote monitoring program is run by the Vanderbilt Ingram Cancer Center at Vanderbilt. Brittney Baer, a patient care nurse coordinator at Vanderbilt University Medical Center, shares how this program helped address three of the biggest challenges facing patients on CAR T-cell therapy: access, cost, and symptom management.
One of the biggest challenges is access to care for CAR T patients. Community treatment centers aren't qualified right now. They just don't have access to be able to give these products, as they're unable to give the products as they're not REM certified locations. They're also not FACT certified, so large academic medical centers typically are the ones able to provide these therapies to patients. So it kind of puts patients that are more at a socioeconomic disadvantage. You know, it's a struggle for them to get to these larger academic medical centers. So that's kind of a burden on those patients. Also, CAR T is very expensive, so insurance is a huge problem still today, even though we've had FDA approval since 2017. So we're working on over 5 years now. So we're still at a constant battle with insurances, trying to get those approved. So those are two of the biggest issues we're still seeing. And then obviously the side effects and trying to keep patients out of the hospital and trying to figure out the best way to mitigate those side effects as best as we can are really the three biggest stickers for these CAR T patients today.
What does this remote monitoring program look like for patients, and what impact has it had on their care?
Yeah, so we've been doing this for about 8 months now, and it's actually very, very, I think it's very cool. And our patients seem to really enjoy it because they don't have to spend nearly as much time in the hospital. But what we do is we hook them up to this remote monitoring platform, and it monitors all of their vital signs 24/7 except for the blood pressure, which is basically they have to take their blood pressure at certain time points during the day. But we hook them up to this a couple of days before their CAR T infusion day, and it monitors their pulse ox, their temperature, their heart rate, their respiratory rate, and it basically continuously tracks their vital signs and keeps them out of the hospital until, one of those vital signs pings us, all the healthcare providers that are what we call on duty. And if one of their vital signs kind of goes out of the threshold that we are watching for, it sends us a notification, and we call the patient and ask them to retake that vital sign or whatnot. And then if it looks like that vital, like for instance, if they're having a fever, we will put them in the hospital for that reason. But it keeps them out of the hospital until, they need to go in. So they're able to rest at home, get more sleep without nurses coming in and out all day. If, they're not having any side effects, people want to be at home or in their local housing here in Nashville.
How are patients responding?
So patients have really enjoyed it because they're not just sitting in the hospital having no side effects, being in there for no reason. So our patients have, even our older folks that, don't really like technology, they have really enjoyed it. So far, so good. We've done about almost 10 patients on it because we've been very selective on who we've kind of piloted this on, and now everybody gets this remote monitoring. So everyone has done really well on it. So we're very pleased. We're kind of tracking data on who basically the time to admission from day 0, which vital sign basically was first to go out of the threshold. So basically, like, was it the fever that kind of pinged us first, or was it the pulse ox? Was it the pulse rate? Stuff like that. Was there a second admission needed? Stuff like that. Was it overnight? So it's very cool to see, and we're excited to see what else we can do with this and how many more patients we can put on this remote monitoring.
Is remote care improving their patient experience?
Our patients have really enjoyed it because it's very minimal work on their part to wear this remote monitoring and, attend these telehealth appointments versus coming into the clinic or sitting in the hospital for 7 days plus. They have enjoyed it greatly. They feel more comfortable at home or in their local lodging here in Nashville. Nobody wants to be in the hospital being bothered that often. And we have really no complaints. The biggest complaints are if we call you in the middle of the night because you have sleep apnea and your pulse ox goes down here and there. That's really the only complaints we've heard. Other than that, people have really enjoyed it.
If you'd like to learn more about this remote patient monitoring model, you can check out Brittney's article in the next Oncology Issues Journal. That will be online and in your mailbox mid-November. Until next time, this is Summer Johnson.
Cancer Buzz is a resource of the Association of Community Cancer Centers.